We have preponed the next session. I call upon Dr. Ashok Bharadwaj, Dr. Anmol Gupta, and Dr. Sashikant to chair the session. Dr. Alexander von Hildebrand from WHO. Introduce, it's okay.
Is the consultant on health and environment from WHO Southeast Asian region. And he has 35 years of experience in the lesser developed countries. Yesterday, he was the chief guest of the inaugural of the 63rd Annual National IPHA Conference. Sir has a very wide, vast experience in his field with several years of work on, as a regional advisor on health, water, and climate change. His present session is WASH, that is water and sanitation and hygiene. I hand over the mic to sir to please continue. Thank you, sir.
Dear chairpersons, estimated delegates, ladies and gentlemen, good morning. Once again, I would like to reiterate my thanks for having invited me to participate in your meeting of the Public Health Association. The topic you have chosen this year is health and hygiene. And this is about exactly that topic. I have been asked to prepare a few messages concerning WASH. This is the title I've chosen: Improving Quality of Care with Safe Water, Sanitation, Hygiene, and Waste Management Services, or WASH Plus. Quality of care, we know about this. Health, I have this definition by WHO. Quality of care defined as the extent to which health services provided to individuals and patient populations improve desired health outcomes. In order to achieve this, health care must be safe, effective, timely, efficient, equitable, and people-centered. I underline safe. You see here to the left the picture of our new Director General, Dr. Tedros. He is a public health practitioner coming from Ethiopia. And it didn't take long for him. Before 1 year, he was already understanding that WASH in healthcare facilities is critical for achieving universal health coverage and needs to be a priority of health systems strengthening. From your work, your daily work, you are very much aware how WASH is such an important element across health systems. I just chose a few publications that are relative to the topic. Concerning maternal, newborn, and child health, we do use a lot these standards for improving quality of maternal and newborn care in facilities, the standards for improving the quality of care for children, young adolescents, the quality of universal health coverage, infection and prevention control, fighting antimicrobial resistance, achieving health resilience to climate. We heard something yesterday. These all are key references that throughout mention the importance of addressing safe, functioning WASH services, essential basic services in healthcare facilities. This is just an example of quality of care in terms of provision of care, experience of care. And if you go to this part, which is the essential physical resources that need to be available, you will find the quality statements mentioning water, energy, sanitation, hand hygiene, waste disposal in facilities are functional, reliable, safe, sufficient to meet the needs of staff, women, and their families. So here again, that's one example. It is all in the books. It is all in the references. Awareness is there. Awareness about the important wash. You can see so many here. I'll just point out this one. Health and safety, reduced healthcare-associated infections, reduced antimicrobial resistance. We are asking pregnant women to come to a health facility to deliver the baby safely. She comes. Unfortunately, the hygiene level is bad. What happens? She gets an infection. Baby also. Maybe she dies. Maybe baby dies also. So how is it we are calling upon the people to come to a healthcare facility where they're going to get sick? If we have a reduced hygiene level, most probably infection risk will increase. With infections, we will use more antibiotic. The abuse, overuse of antibiotics is taking us to antimicrobial resistance. You also know, in 5-6 years' time, some of our most precious antibiotics will be no longer effective. Wash, meaning hygiene, meaning cleanliness, meaning reduction of infections, meaning less use of antibiotics. Wash is also a driver to reduce costs. A proper wash will allow you to perform better, more efficiently, and of course reduce diseases and even deaths. Yesterday I was presenting a bit on climate change. Our health facilities need to be climate resilient. We know that climate impact is coming upon us. Our health facilities need to be robust, need to be climate proof. If your facility is not having proper wash services, it will not be climate proof. Will not be. It is like, yesterday we were talking, it's like driving a car without a safety belt. It's like driving a motorbike without your helmet. What is the Wash Plus thing I was putting at the beginning? It's just to agree with you. It concerns water supply, adequate and safe water, safe drinking water, adequate amount, sanitation, adequate toilets, safe disposal of wastewater, hygiene, hand washing facilities, soap and water, and of course, healthcare waste, proper, sound management of healthcare waste. These are the 4 elements of Wash Plus. Often, wash is only understood as water, sanitation, hygiene. We need to emphasize on the biomedical waste component. Are bringing standards for all these elements that I'm now showing you. Water, hand washing, sanitation, waste management, even control of vector-borne diseases, hygiene promotion and management. These are the 2 reference books that we are producing, and I'm very happy to hear that they're still very much used. This book is mentioned often as the Blue Book, which is the guide for healthcare waste management. And that Green Book now has been updated. I will show you how. You may wonder, why is it that we are now spending time and talking Wash Plus? It is an obvious issue. What's new about it? Well, look at this. A WHO UNICEF study was done, 2015, carried out in 60,000 facilities in 54 countries. going to check how is the wash situation in health facilities, in those 60,000. Look at this. 38% do not have access to an improved water source or a water source near the facility. 38, no soap for hand washing. 19 without sanitation, 19%. This is the data from the assessment to 2015. Then we have data from the Southeast Asia region. Incomplete data, 6 countries, 22% of health facilities have no water, 66% don't manage their waste properly. We have data from India. It is an old data, it's 2012, before Kayakalp. And that data showed 45% of healthcare facilities in the country had no functional toilet. We know now, thanks to Swachh Bharat, to Kayakalp, things are going to change drastically. But this is just giving you a picture how neglected it has been and still is in many countries. We carried out in 2018. This time 130 facilities, 78 countries. 33% neglecting sanitation. This is just some kind of result of all this. Some kind of policies, very few only implement them. Taking this into account, the new Director General coming to the head of WHO, together with UNICEF and WHO, we developed a tool called WashFit, Water and Sanitation for Health Facility Improvement Tool, WashFit. And this is what I want to present to you. This is taking off now very nicely. It is integrating the essential environmental health standards, but not only that, it's going further. It is looking very much into management issues. And this is the approach we are using. This approach for you that may be familiar with water safety planning is a similar one. As we enter, as we visit, as we go to do an assessment at a health facility, we assemble the team, we conduct the detailed risk assessment, risk-based management tool, we use the forms, we do a transect walk and point out all the potential hazards, allow us to identify prioritized area for improvement and come out with a plan. An incremental improvement plan. This and that can be addressed now, next year, how is it? And continuously we then evaluate this plan, these areas. Water sanitation, hand hygiene, cleaning. Specific issue, how to clean and keep clean. What we have seen, many of you maybe, often the cleaning is done by the person that is maybe illiterate, using the same broom, the same cloth in all the different rooms, taking the infection risk all over the place. Environmental management, facility management, all these elements are part of the WashFit. This is one sample of the forms. It is very detailed. The questions are there, left, yes or no, average, poor, to do the assessment and using these forms. And certainly we can fulfill the quality of care standard, number 8, that every health facility should have basic infrastructure, amenities, including water, sanitation, hygiene, waste disposal, to meet healthcare needs of women and newborns in the facility. And we can also fulfill the quality statement that wash and energy are functioning, reliable, safe, and sufficient to meet the needs of staff, women, and their families. You can find all this, what I'm talking about, in the website that is mentioned here, how Dr. Tedros is very much interested in this issue. but also UN Secretary General, the big boss of all United Nations agencies, of all the 28 United Nations agencies, Antonio Guterres. He came to the Mahatma Gandhi International Sanitation Convention in New Delhi that was held, I think, in November. He came. What did he say there? Poor sanitation in healthcare facilities carries even more serious risks. More infections, prolonged hospital stays, higher death rates. That was the background to my global call to action in March. He did that last year in March. Global call to action for water, sanitation, and hygiene in all healthcare facilities by 2030. In all healthcare facilities in the world, global target, all should have by 2030. Improving sanitation is not only the right thing to do, it is also economically the smart thing to do. What are the targets? At least 50% have basic water services by 2022. 80% 2025, 2030, all of them. Oh, we need to be from currently 50, 60% to close to 100%. The knowledge portal, you see here. You get also a newsletter if you apply for it. We're also on Twitter, and you're all invited to participate in the action plan. WASH in healthcare facilities, WASH Plus. I thank you very much for this, listening to me. Thank you all the workers that are helping us in this very important task to keep mother and child healthy. Thank you very much.
Thank you, Alexander, for very lucid presentation. We have some time to take a few questions from the floor. I would request Professor Ashok Bharadwaj to coordinate the question answer session.
So, thank you. So, I also thank Alexandra for a beautiful and informative session on the most burning topic which is there in the country, because we are all going through Swachh Bharat Abhiyan, and I will request the participants or the delegates to, if you have any query, then you can put that query to Mr. Alexander. No question? Yeah, yes.
Thanks, Mr. Alexander, for an excellent presentation. I just like to know antimicrobial resistance, is it addressed in this perspective? Can you just highlight a bit on that?
Thank you, Dr. Prudvish. Yes, you are aware of the antimicrobial resistance action plan. It is a global WHO-led action plan, although we work on this with the OIE, which is the organization in charge of animal welfare. We also work with ministries of environment, because the antibiotic abuse actually is happening more in the animal world as a preventive measure for reducing risk of disease. 75% of antibiotics are used in that area. So we need to coordinate. We need to make sure we look at that's one objective. That is why it's called One Health approach. One Health. And your question whether we are also looking at that issue with the wash fit. I will just answer in this manner. The antimicrobial resistance global plan has triggered national antimicrobial resistance plans. Each country has one now. Each country is receiving funds to implement. Maldives heard about WashFit a month or maybe a little more than a month ago. They are organizing their first workshop in 2 weeks' time in Mali. And they're getting their money from the Antimicrobial Resistance National Action Plan. So this time they are really working together. The people in charge of fight against antimicrobial resistance have understood that this is a very effective way to reduce that risk of antimicrobial resistance.
So, sir, before asking question, please introduce yourself.
I am Sanjeev. I work for UNICEF. Very interesting presentation, Alexander. Just one quick question. You have any India-specific data on usage of WashFit? Means which are the states or which are the organizations have used it? And if their experience are collated somewhere, because we tried using it in some areas of Karnataka last year, 2018. 2017-18, we used it in select facilities, and we tried advocating to other places. But do we have these lessons collated somewhere, some best practices with regards to WashFit?
Thank you, Sanjeev. In terms of best practices, we surely have in terms of addressing WASH in healthcare facilities. But using this approach, WashFit, which is more comprehensive, holistic approach, we only have experiences in some 10, 15 countries. Most of them are not exactly the least developed countries, but where we still lack support is the use of the app. We do have those experts that developed the app who would like to come and help us to do the hands-on training. Just as I was mentioning to Prudvish, in Maldives, they are interested in the app because they are spread out islands and they need to, with the app, they could communicate and share data, etc. So there is a big request for this software. Yet we don't have enough experience with the software. And I think this could be an ideal moment to practice this in India and to get the experience from India to really solve any issues with the app and make it, you know, as you are doing so well with so many apps here. That is one point that we need to address this year. So I suggest that those that are interested, we should keep in contact. Otherwise, the WashFit as such, using the book and the forms, I don't foresee like any kind of surprise. It is too early for us to report back to you on lessons learned, and because it's too young. It's only it's about a year and something old. But where we still need to emphasize is using the app. That's what I'd like to say.
To have one rally which will be covered by all the delegates which are coming to Indian Association of Preventive and Social Medicine conference on 9th March from the Ridge Shimla to Hotel Peterhof. It will be a heritage walk, and all of you are invited for that heritage walk, where we will give this message of Swachh Bharat Abhiyan to all the public. Thank you very much.
And I request Dr. Krishna Babu sir to please present the mementos to the chairpersons.
I thank the speaker once again for approving and obliging to our request and preponing the session.